people who take Novo Nordisk GLP-1 drug are at a greater risk of developing suicidal thoughts if they also suffer from anxiety or depressive disorders. Novo Nordisk's go-to GLP-1 drug formulation, which uses semaglutide as the primary agonist, is increasingly being left behind in the weight loss efficacy race, overshadowed by the next-gen offerings from the likes of Eli Lilly and Company and VK Therapeutics. Now, a new study also raises the specter of suicidal ideation vis-à-vis Novo Nordisk's primary anti-diabetes and anti-obesity offering. GLP-1 drugs, risks versus reward. The GLP-1 drugs from the likes of Novo Nordisk and Eli Lilly and Company mimic the GLP-1 hormone that is released naturally in the gastrointestinal tract as a response to eating. The hormone increases the level of insulin, which then reduces the blood sugar level. In addition, these drugs also bind to brain receptors, reducing the rate at which the stomach empties its contents into the small intestine and creating a feeling of fullness and satiation in the process. Novo Nordisk, NVO, uses semaglutide as its proprietary GLP-1 agonist in drugs that are marketed under Ozempic and Wegovy labels, with the former geared toward type 2 diabetes and the latter marketed as a treatment for obesity. Similarly, Eli Lilly and Company, LLY, offers tirzepatide as one of its proprietary drugs to combat diabetes and obesity, marketing it under the Mounjaro and Zepbound labels, with the former geared toward diabetes and the latter billed as a treatment for obesity. In fact, the company's CEO recently claimed that people who used Zepbound consumed 800 calories less per day. Of course, the newer offering from Eli Lilly and Company that leverages GLP-1/GIP dual agonists continues to outperform in terms of efficacy, with a recent study noting that the drug is able to reduce the risk of diabetes by a whopping 94% over 3 years. On a macro level, the GLP-1 drugs offer a myriad of benefits, ranging from controlling the so-called fatty liver disease to reducing the risks associated with osteoporosis. These drugs have even been found helpful in overcoming alcohol addiction. It is hardly a surprise, therefore, that around 5% of the population in the US is estimated to be already taking GLP-1 drugs. What's more, the increasing use of these drugs is giving rise to new phenomena, including Ozempic babies, a term that is used to explain a perplexing increase in fertility post-treatment, and the Ozempic face, which alludes to the sagging of the skin after rapid weight loss. In fact, the demand for these drugs is so strong that it has created an entire avenue for the black market. For instance, the UK recently witnessed a proliferation of fake Ozempic bins that resulted in a number of hospitalizations. Of course, as is the case with almost all pharmaceutical interventions, GLP-1 drugs do carry risks, which range from nausea to neuropsychiatric disorders, including suicidal ideation. New JAMA study, semaglutide is linked with a 45% greater likelihood of suicidal ideation when compared to other drugs. This brings us to the crux of the matter. A new JAMA study conducted a disproportionality study of the WHO's database for suspected adverse drug reactions, ADRs. For the benefit of those who might not be aware, a disproportionality study compares the actual number of ADRs with those that are expected based on the proportionate ratio of ADRs for all other comparable drugs in the database. The study found elevated instances of suicidal ideation, thoughts of suicide, for the semaglutide GLP-1 agonist, especially for those on anti-anxiety and antidepressant pills. The study also linked increased suicidal ideation with the possible off-label use of semaglutide. Our findings are relevant to the general reader seeking up-to-date information. This relevance arises from the expectation that personal or anecdotal reports may continue to gain popularity on social media platforms without knowledge about risks. One consequence of this trend may be the increase in off-label use of semaglutide, which is a public health concern that has led to the illegal trade in semaglutide bins, some of which are counterfeit. As for the takeaway, readers should note that the study does not establish a causation between semaglutide and suicidal thoughts. It does, however, press upon healthcare practitioners to be aware of suicidal risks associated with semaglutide in patients that are already taking antidepressants or anti-anxiety pills. What's more, other studies have completely negated any association between the semaglutide GLP-1 agonist and suicidal ideation. Both the US FDA and the European Medical Association continue to investigate this link with only inconclusive results so far.